Good morning. I want to thank the Society for granting me the opportunity to present. I have nothing to disclose other than I have to wait 7 seconds as ordained by sages to let this pass. Abdominal compartment syndrome is defined as an intra-abdominal pressure greater than 20 millimeters of mercury with one end organ dysfunction. Although the incidence varies between 2 to 8%, the prevalence has been noted around 3.6% in previous studies. Oftentimes, delayed diagnosis can lead to either one system failing or multiple organ system failure, can lead to severe morbidity and even mortality in cases, and this may often trigger legal redress. As you can see, there have been previously published malpractice claims over here published by one law firm. Failure to timely diagnose and treat abdominal compartment syndrome led to severe complications, including brain death. This was a $300,000 malpractice claim for failure to timely diagnose abdominal compartment syndrome, and then really a substantial payout from the state of Massachusetts of $14.5 million in a case of abdominal compartment syndrome, which led to mortality in a case. Nearly 11% of physicians will spend half of their career, a 40-year career, with an open, unresolved malpractice claim. And this for every year, 15% of practicing general surgeons will face a medical malpractice claim. And then by age 65, nearly all surgical high-risk legal specialties, such as general surgery, among other surgical specialties, will likely face a malpractice claim itself. And this causes a great amount of distress for physicians itself. As you can see from this data point, that claims were and payouts were found to be going down, but then there was an inflection point at 2012, and now we see that claim data has started to go up again with award payouts itself. So it's just important data to kind of look at from the National Practitioner Data Bank. So really, the aim of this study was to look at and understand litigation in the setting of abdominal compartment syndrome. This is something that we all, as surgical specialists, may often face. And so we used Westlaw Next, which is a publicly claims legal data set that captures medical legal data from all state and federal jurisdictions within the U.S. Using a Boolean search strategy to identify all abdominal compartment syndrome cases. We excluded all duplicate cases and cases where the primary reason for litigation was not the abdominal compartment syndrome itself, and we came out with 30 cases total. In these cases, we looked at the primary setting of the case characteristics of the patient itself, the allegation of the lawsuit, as well as the outcome. In terms of our results, we found that the average age of our patient was 44 years. Most of our patients were found to be male itself. Although most of the patients were adult, there were 2 cases of abdominal compartment syndrome in minors. Oftentimes, lawyers will end up putting multiple defendants on cases because it may lead to higher payout itself, including the hospital. The most common surgical case leading to abdominal compartment syndrome was bowel resection, whereas afterwards, aggressive resuscitation led to development of abdominal compartment syndrome that was not timely addressed. And then looking at the National Association of Insurance Commissioners' grade of injury, grade 7 is really a permanent injury of some sort, which was done to the patient. And then mortality was reported in 53% of cases itself. And also it was alleged failure to obtain informed consent, which was noted in approximately 1/3 of cases. The most common reason for litigation overall was found to be failure to timely diagnose and or treat the abdominal compartment syndrome. And as mentioned, in 63% of these cases, there were multiple operations which were required, and this was a cause of why the patient or the family ended up pursuing legal action. Looking at the results, this was interesting. The state of New York, which is my home state itself, as well as California, had the highest number of kind of cases overall throughout the country, and these are the highest litigious states as well that have been noted throughout the United States. In terms of outcome itself, most cases were in favor of the defendant. However, median award payout, you can see, is $2.4 million. So this is significantly high. There was a difference between case payout in cases of a settlement or arbitration, and then cases of just award payout itself. Our study is not without its limitations. The amount of medical information was limited in some cases. This is a small case size itself, so this may have not captured all abdominal compartment syndrome medical legal cases. And then furthermore, tort reform over time may not really be able to look at changes. And in conclusion, abdominal compartment syndrome has led to malpractice claims in the past. Most cases were decided in favor of the defendant. However, failure to timely diagnose and or treat has been the case of medical malpractice claim study. This really favors the clinical axiom of identifying and addressing abdominal compartment syndrome with the use of a protocol at an institution that may help with overall adverse outcomes. Thank you.